So good morning, everyone. Welcome to the second day of the Giant Health Show. It's great to have you all here in the stage two of the show. We had a really great day yesterday. It's really awesome to have everyone back in a venue and connecting and meeting and seeing what progress has been made whilst we've been away, as it were. So a couple of years since we were at Stamford Bridge running Giant in person last time, which was a different sort of venue. So today I'm going to be your MC and looking after this stage. So it's a great privilege to be here doing that. We have quite a range of different topics and people here talking about all sorts of things. So we're starting off in a moment talking about female-centered technologies and female founding and all the challenges and issues around systemic bias in that space. And that's one of the tracks that Thrive are putting on. And we also have something at the end of the day that we're doing as well around age-related and healthy aging. So please do come to those two. But in between that, we have a load of exciting things as well. Firstly, from the AHSN, so a fantastic network of people working in and around the health service and offering, I guess, connection with innovation and connection between people who are looking to get technologies out there. So that should be a really great show at 11:30. We're looking at IP and specifically some discussions from the Wither and Rogers team at 12:30, and after lunch 2:30 we are going to be looking at real world evidence at scale using advanced analytics, and that should be very interesting. That's one of the McKinsey sessions. After that, a fireside chat with another team from McKinsey looking at operationalizing advanced analytics in real-world evidence. Bit of a mouthful, but sounds interesting. And then we'll, as I say, finish off the day with the second of the Thrive sessions. So that's the running order. We have a reasonably long session for coffee break and networking at 10:30. So if we drift into that a little bit with this session, being as we started a little bit later than planned, there's been a little bit of confusion about getting people in and what the start time was. So we'll be potentially drifting to that if we need to. Depends what happens, through the discussion and what questions come up. I am going to really be asking in this first session for input from the audience. I'd love to sort of hear what people are up to, what your take on the topic is. And I'll ask you in a moment to kind of give me a bit of an indication of what sort of category you fall into in terms of academic or health person or so the first of today's sessions is looking at serving women better through technology. And it's a really important area, both because from an equality and diversity point of view, it's massively underrepresented, as we all recognize, I hope. And from a business point of view, it's a fantastic opportunity as well to bring new products to market and to create innovations in that area. And that is really ripe for disruption, as they say. So without further ado, I'll just do a bit of an intro into Thrive and the session. And we'll start by, we've seen our panel. We'll come back to them in a minute. So Thrive are a team who work on creating technologies in the wearable space, and we look to create things that have really significant impact in terms of health outcomes. The opportunity more broadly is that health systems are in a bit of a shambles. There are many opportunities to do healthcare better. As we all know, probably from interacting with the NHS, it's a very reactive organization, and we want to try to create technologies that we can introduce into the NHS and to other private settings that have that disruptive and kind of high impact effect, mainly based on data, on real-time measuring, and bringing those things together to create different health pathways. So that's what we focus on. We have some different ways of operating in terms of our business, and we can talk about that a bit more later. But our team comprise basically physical device development people, digital services, so we do apps and web interfaces and those kind of things. We also work extensively with data from the point of view of kind of physiology measurements, normally looking at body signals and interpreting those, so real-time data, and then trying to run algorithms on wearables that have the effect of making those wearables more user-friendly in terms of how they connect with the rest of the world and those kind of things. So we're focused on those areas and developing into the health and wellness space, as I said, predominantly fitness, those kind of areas as well. couple of just case studies for the things that we've been working on that are relevant to this session that we're going to do today. So this is a belt that we've created for a team over in France who wanted to look at pain management non-invasively for specifically period pain and endometriosis, which are huge unmet needs. So just sort of relating back to this topic today, there are these markets that are emerging that have real fantastic potential from a commercial point of view. And this is probably a good example of that. So we've worked on this for quite a while, through lots of stages of prototyping, and it involves quite a few traditionally disconnected industries. So fabric technologies and electronics are sort of coming together slowly, but it's quite a difficult thing to bridge those two. And we're really excited by some of the opportunities that are emerging there. This is non-invasive pain management using vibration and heat therapy, essentially. And a really exciting project that we've worked on for quite a few years in relation to breast cancer. And again, this is a sort of fabric meets hard technology situation where you're trying to measure something with electronics, but you need to pay attention to ergonomics and to human factors. And again, it's a really fantastic example of an unmet need. This is a continuous monitoring system, or a spot monitoring system that is much more continuous than the standard mammogram that you would have in a clinical environment. So this is something you maybe could use once a month, once a week to keep track of potential issues, especially if you have genetic issues in relation to breast cancer, for example. So another good example of both what we do and also the sort of fabric electronics bit. We're quite development, and it's relevant to many markets. So we work globally, and we've got lots of projects all over the place. And here are a few of the people that we've worked with. So what I'm going to do now is just go around the room and just kind of try and put people in these boxes a little bit. So bear with me. I want an answer from everyone, just so I can get a sense of who we've got in the room. Hopefully these categories cover everyone. You can be in the other one if you want, but don't all go there, please. Or otherwise I'll have made a complete mess of understanding the room. Are there any investors in the room, first of all? Anyone investing into technology? Okay, fantastic. So we've got one investor, people who consider themselves predominantly as entrepreneurs at this stage. 1, 2, 3, 4, 5 entrepreneurs. Academics, anyone in the academic space? One academic. And people in a corporate or SME environment coming to the show. You're both in. Okay, corporate, cool. So three, was that 3? Hands up again, yeah? 3 there. So who didn't put their hand up? Everyone else put your hand up. 2 at the back. I know you 2. I know you 3. So we've got 5 people there. Anyone else not in one of these categories? Okay, so at the back, where are you from? A law firm. Okay, awesome. So patents and that sort of thing, or general law? Okay, awesome. Fantastic. So we've got a bit of a mix, as you'd expect. So that's good. I did kind of just about get the categories right. That's cool. Let's see if we've got the others on the line. Have we got the rest of the panel? Right, so we're going to jump into the panel discussion. Serving women better through technology is the broad theme. And hopefully we will bring in, yay, hello everyone. Looks like they can hear us. How do you want to do this, Anna? Should we, yeah, if you grab a mic, maybe I'll grab one as well. Yeah, should we sit inside? Fantastic. You all well this morning? You can hear us all fine? Yep. Fantastic. This is my first time doing any kind of virtual curation, so you'll have to bear with me if it goes wrong, but I'm sure we'll get it sorted. Anna will look after me, so we're all good here. Great. I think we'll start with the obvious, which is some introductions. Anna, as you're here, let's jump in with Anna Goodmanson, please.
Sure, thank you. So my name is Anna Goodmanson. I'm co-founder and CEO of BioSelf Technology. And together with Thrive, we've developed the Sensate, which uses infrasonic vibration to tone the vagus nerve, very effective for stress and anxiety and a lot of other things. So it's my excellent co-founder, Stefan, who's the innovator and the sort of, from the medical perspective, clinician behind. I've actually programmed over 15 years ago. I've been in senior management roles for the last 15, 20 years. I've been in large, small companies, raised money, scaled, sold, etc. And I also have a huge passion for human evolution and how technology can be changed for good and have a really positive global impact.
Fantastic. Thank you, Anna. Let's start from the top left. Annika, would you like to introduce yourself?
My name is Anneke van Ome, and I run a wearables and soft goods design agency in Rotterdam, Netherlands. Therefore, also joining remote. I've been working in the field of wearables, especially medical wearables, for over 10 years. And Jacob just explained the project with Zetzen, the breast project. And I've been working on that one as well. So I have some experience with femtech projects. But especially with product development for niche target groups like children with Duchenne muscular dystrophy. There's a bit of an echo from the venue, I guess, in my mic, so it might be a bit weird to explain. And I can see the venue, so it's a really odd experience, but I hope I can contribute something nice to the panel discussion as well.
Okay, thank you, Annika. Yeah, we can hear you fine here, so apologies for echoes at your end. Hannah, would you like to introduce yourself, please?
Of course, yeah. So hi, and I hope you can hear me clearly. I'm Hannah, and I'm the co-founder and CEO of Juno Bio. So I have a background in biology and biochemical engineering, and I worked as a microbiome scientist. And microbiomes, for those of you that might not be familiar, are all the microbes that live in and on us and have a huge impact on our health and wellness. Working in this space, I was just extremely shocked by the lack of work, research, products for women when it came to the microbiome, and specifically the vaginal microbiome, because it's implicated in over 30 conditions that affect billions of women worldwide. So I formed Juno in 2018, and at Juno we decode the vaginal microbiome to close the gender health gap. We ran one of the world's largest studies in 2019, and last year we launched a vaginal microbiome test that gives women unprecedented insight into their microbes and what it means for them, and also powers up research on the back end as well.
Fantastic, thanks. Great intro. Sophie.
Hi, my name is Sophie Smith. I'm the founder and CEO of NAVTA Health. Just as a heads up, I think we virtual participants can't hear each other speaking at the moment. So I'm not sure what Hannah and Annika said in their intros. NAVTA Health is a hybrid healthcare company for women. We are headquartered in the UAE. We enable women to detect, diagnose, and treat chronic diseases, focused on, I would say, underrepresented populations in clinical research and trials in the Middle East, Africa, and South Asia. We had a slightly dubious privilege of conceptualizing this hybrid healthcare model back in 2018, actually long before the pandemic hit, combining digital and traditional healthcare along clinical pathways to enable patient-centric, decentralized care with a kind of augmented intelligence overlaid. It's hybrid. Everything is now becoming a lot more mainstream, which is good to see. In terms of my background, I worked as a technology consultant with Accenture for 4 years. I actually have a degree in history. I then went through the process of setting up a number of different enterprises focused on emerging markets, a doctor finding appointment booking platform in Pakistan, a plastic recycling company in Sierra Leone, before landing on NAVTA, which I hope will be the company that I run for the next 30 years.
Sophie, have we got the technical issues sorted? Can the rest of them hear each other now? Yeah, that's all good. Fantastic. I also want to say a warm welcome to our audience online, because I believe we're live streaming as well. So the sorts of people out there hopefully tuning in to this session. I'm not sure if there's a conduit for questions to come from out there, but if there is, please get those coming in as we go through the session. And likewise, in the audience, get your questions ready as we start to go through this session, because it's going to be a bit participative if you're willing to work with me on it. Okay, so I'm going to start by diving right in. And I'll put this one out to the floor really and see who wants to pick it up. There's a bit of a conflation between the terminology femtech and sex tech. I'm not sure if I like either of those terms or understand that conflation. Can anyone sort of target that and tell me more about what they reckon?
So I think this is something that has been covered by Dr. Brittany Barreto of Femtech Focus actually on a number of occasions. Femtech Focus, now an official partner of Crunchbase, has recognized, I would say, or started to recognize the potential of the women's health technology industry, broadly speaking, valuing it at $1.186 trillion by 2027. And this is split across a number of different segments, of which reproductive or sex tech is one. Chronic diseases is actually the largest segment at $218 billion. But I think, yeah, it's important to recognize that when we talk about women's health technologies, we're talking about things that are able to materially improve women's health in general. Again, acknowledging that women were mostly excluded from clinical trials until 1994, which means a whole load of different things. But for example, women are still 50 to 75% more likely than men to suffer adverse reactions to drugs, because a lot of drugs, a lot of medical devices, a lot of procedures haven't actually been designed to cater for women. So when we're talking about technology that can improve health outcomes in women, we're really speaking across the board. And it's very common to have women's health referred to as a niche. But again, when we're talking about women's health, we're talking about something that can improve health outcomes in over half of the global population. So it's a lot broader with then many different verticals underneath it.
Yeah, I guess just to the point that Sophie said, it's incredible to consider that women were largely excluded from clinical tests until 1994. So that is just so recent. And just the fact that, I was on a panel recently with Helen from, forgot her company. I think you know her as well. And she pointed out that pretty much when we talk about health tech, there's actually man tech, and that is only representative of half the population. So, and then I was also going to make the point that hopefully both men and women have sex. So sex tech clearly shouldn't be something for only women.
Yeah, I completely agree. Really, just crazy that we've got that data gap. Is there anything else that people have experienced or that kind of relates to their work in relation to that data gap issue? Because it's so broad. I mean, we could have an entire session just on that, I suspect.
I think there are a lot of really nice examples. One, for example, is that there isn't currently a single wearable device on the market that is capable of accurately tracking steps if you're pushing a buggy, which for women who are trying to recover postpartum is obviously something that's pretty critical, especially if you've been very active prior to conceiving your baby. And the reason for that is because most wearable devices are designed by people who are not primary caregivers and don't push buggies, be they male or female. And so that's one example, but there are dozens.
Hannah, do you have any challenges in your work in terms of, firstly, the microbiome, which is quite a new thing in terms of being, I guess, productized and being turned into something of relevance, and then the data gap on top of that? Tell me about how you kind of validate what you do.
Yeah, it's really interesting because when it comes to the microbiome, yeah, it's a completely newish space of medicine. And so there's obviously a gap in terms of research and data just broadly because it is an innovative space. But the funny thing is that all the challenges that people might normally associate with the microbiome aren't always at play when it comes to the vaginal microbiome. The vaginal microbiome is sort of ripe to be taken to the clinic and to be taken to the patient and used in a meaningful way. And I guess it's a shame that wasn't one of the first microbiomes that people focused on, even though a lot of the challenges that stop gut microbiome research, etc., being translated don't apply to it. And obviously the gap then specifically in women's health in the microbiome world is huge. There just hasn't been enough funding, enough work, enough research into it. So I mean that challenge is the challenge that Juno Bio is trying to solve.
So quite a big challenge, and lots of blockers, which I guess is a theme across many of the areas we should probably talk about. You know, blockers and things that have been put in the way historically and that remain in the way in terms of being able to get traction in this space, both from a research and data point of view, a systemic point of view, etc., etc. What I did miss at the beginning of this was to set the scene a little bit. I dived straight into these really relevant questions because I was a bit excited, but we agreed to have a kind of a sort of goal, I suppose, for this session, which was to explore the state of play, opportunities and blockers in the development of products and services for biologically female users and for female identifying founders facing systemic bias. And I think all of the kind of discussions so far, you know, really do link into that systemic part of the problem. You know, when you look at the media and you see changes both from a diversity in terms of race point of view and from a women point of view, do you feel that we're getting there, or are we just really not getting there and it's all just sort of spin? How far along that path are we to some kind of transformation in that space?
There was a really interesting report. Oh, go on.
Yeah, I was saying, if I may, from our experience at Juno Bio, having, you know, started in 2018 and now it's 2021, we've seen that while there's a lot of work still left to do, there is a lot more attention being paid to femtech and just the women's health and space in general. So we've seen a massive increase in the amount of investment that goes into companies like ours, and also we've seen policy and policymakers start to pay attention to this area. And so I think this year, some of you might be familiar with the announcement from the government that they are working on a women's health policy. And a lot of the companies that we know in Juno Bio as well are contributing to changing not just, you know, the startup landscape or that in that sense, or the academic landscape, but policy as well. So I think there's a real shift to meaningfully changing and closing the gaps that we see.
That's reassuring. Sophie, do you want to jump in?
Yeah, I was just going to echo what Hannah said. Actually, I think this year we've seen a shift in frustration levels more than anything else. The statistics were there before, but there seems to be now a real collective frustration with the fact that in terms of capital that is really available for female founders, and female-oriented companies, there's not only is there not been a change since the pandemic, but we've actually gone backwards. For example, and again, it depends on which part of the world you're in, but in the Middle East, we have had a record year for funding this year. I mean, Femina closed a large amount, almost $2 billion. 0.9% of that has gone to female-founded companies, which is about the same materially, so it's about $18 million that was invested last year, but proportionately it's fallen by 50%. And there are a couple of things that have contributed to that. Fewer deals, larger deal sizes. And one of the issues that we see, and it's something again that's been reported on a number of different times, is that at pre-seed and seed stages, where you are judged based on your potential to scale, your potential to innovate, your potential to generate revenue, women are judged much more harshly than men. Women tend to be judged in general based on what they've achieved, and men tend to be judged a lot more based on their potential. And so once you reach Series A, where it's all about unit economics and about traction and about revenue generation, the playing field actually levels off. Still, there's quite a disparity in terms of ticket sizes, but in terms of your likelihood of securing funding, that levels out a bit. The problem is that a lot of female-founded companies don't get there, and either they don't raise funding or they go down a completely different route. One of the things that was quite shocking to me last year, and we did the F-Lane Accelerator for Female Empowerment, which was a Vodafone Institute, Mohammed Social, Yunus social business initiative, picked 10 of the top companies around the world that were working to empower women in emerging markets. Was that when we had people come in, and very, very high profile people come to talk to us about investment, the universal piece of advice we received was, don't even bother going down the angel investment venture capital route because you're women. Look for grant funding, look at crowdfunding. And when that's coming from top professionals in the field who are supposed to be supporting you and opening doors for you, and they're saying, I'm sorry, but these channels that apply to male founders don't apply to you, you know there's something wrong. I think, again, trying to hammer home actually what these statistics means is really important. If you, Jacob, was sat in a room with any one of the women on this panel with a startup, and there were 100 investors in the room in the Middle East today, 99 of those investors would give their money to you, and just one of those investors would give their money to one of us. That's the difference that we're talking about. We go through schools and universities being taught that we are equal. We have the same amount of time in exams. We have the same number of hours to study. When we picked for teams, the teams are the same sizes. Everything is fair. And then you step out into the world of work and you set up companies and you start trying to pitch for funding. And suddenly the odds are 99 to 1. And something has got to be done about it.
Wow, that's a compelling situation and one we should definitely look at. I'm going to sort of take that less positive note after Hannah's started for 10, and ask Anna what your experience is in Silicon Valley. I know you're over there a lot, raising money all the time, as many founders are. Tell me about what it's like going into a room in LA.
Yeah, so I think we're at a really interesting place where there's a lot of conversation about the topic, but it's not showing in the statistic, like Sophie just said. So also when we look at the percentage of funding going to female funders, we talk about something like 18%. Actually, 80% go to male only. And then we got 2% that go to female only. And then the others are, there is one female founder. So it's also just looking at what those statistics actually mean. So having been in the industry and also raised money for some time, and I'm going to be very brutally honest here, we sort of passed this stage of inappropriate comments and like this kind of very obvious sexism, which indeed, I mean, having been for 20 years in the technology industry, there was a whole bunch of that as well. So no one is now going to talk about what you're wearing or necessarily chat you inappropriately and all that. So we kind of passed that. So now we're at a challenging stage where it's all unconscious. And so what I'm experiencing right now is quite interesting, is the amount of compliments we get as women for our achievements. So our startup, for example, we have, I'm going to be very honest here, so sharing, we've only raised 2.5 million to date. We've developed stable hardware, stable firmware, stable software, and we've had revenues of over 3.4 million. As an early stage company, this is really good. And I get people are telling me, Anna, it's fantastic what you've done. And, also some investors ask me to give advice to other portfolio companies, how they've done it, etc. And then I'm going, why aren't people throwing money at me? And I'm just sharing as an example. But then I look back at my career, and actually it's quite typical that you sort of expect it to be a superwoman. So we give compliments to women and we invest in men. And this clearly is the case if we look at the numbers, right? And so now this is very subtle, difficult, unconscious bias we get to, because not a single man or woman would know that they're making these decisions. They say, oh, a lot of people, so it's going to be so easy for Anna to raise the money, the product. Oh, I should mention as well that the user statistics are like 10x competition. So, and I think that's the challenge now. And what do we do? Because similarly, obviously, in many other areas, I'm in dominant group in terms of being white, in terms of not being of certain religions, not disabled, etc., etc. So we have to educate ourselves. And now moving to the United States, there is a very different sort of landscape in the racial area. I grew up in Sweden, so I had to read books. We have to understand, and I think that's as well what we need to do. If we're not actively trying to change the situation, we are part of the problem. And I think that's now where it's harder to point at what people are doing, and it is up to us to educate ourselves and be the change. I see a lot of shift in terms of conversation, but it's not yet turned into any change in the numbers.
For sharing this, sort of again quite shocking. I'm assuming that the rooms you go into are still predominantly white male, so that's a sort of finance and money problem even further up the chain. Hannah.
Yeah, sorry to have interrupted there. I'm conscious that there are two sort of things at play here. One is investments into companies that are maybe focused on women in terms of their products, and then investments into companies that have female founders. And I wanted to throw it to the panel whether they've experienced a difference in those two aspects of it.
Yeah, I have just a very little anecdote here, actually, which was a male-funded company that made a like sex toy vibrator as a piece of jewelry. And they raised loads of money, and it never got anywhere because there was actually no women that wanted this particular product. But they got lots of funding that didn't go anywhere. So I'm sure people have better examples.
Another great example. Another great example of that was Pinkygate. Did you read about Pinkygate last year? So Pinkygate, I saw a hand up in the audience. Yeah, that's how I feel. So Pinkygate was a couple of male founders who designed a pink glove that could be worn by women to remove tampons. There are so many problems that are wrong, like problems with this pitch, that women would think removing a tampon was a disgusting thing that required a glove. That they couldn't just, if they thought that way, they couldn't just use a regular glove, like a regular latex multi-glove in a pack kind of glove, as opposed to a pink one. Anyway, successfully raised funding, and not quite a sizable pre-seed round as well. And there was such outrage across the internet that they were forced to give the money back. But the fact that other people went, yeah, gosh, you're right. You know, removing a tampon is really a disgusting thing to be doing. This is something women need. Is probably an example of why there's a problem. I think there are. I feel, having gone over this ground a lot of times, that having a female-oriented product and being a female founder are compounding problems more than being separate. So, for example, why do people invest in things? I think people invest in things a lot of the time because they go, God, that's really cool. Like, that's your initial response to something you want to invest in. God, that's really cool. And unless you happen to have struggled with conceiving or with your cycle for a long time, and you've been battling your vaginal microbiome in one form or another for a lot, unless you've got a vaginal microbiome to be bothered about, you're probably not, or unless you have a medical background and this is something you've studied or interacted with, you're not necessarily going to go, yeah, this is a really cool product. But it is, and it will solve problems for a lot of people. You know, I have this, my brother actually at the moment is working on a company that's doing charging for electric vehicles, so mobile charging for electric vehicles here in the UAE. And he's in the early stages of raising funds, and everybody he speaks to had that reaction. God, that's so cool. And give him a month, they're going to be throwing money at him. So I think that's part of the problem. Is, you know, if we're pitching to predominantly to people who are never going to think that women's health issues are cool when they're solved, then the investment isn't going to happen. And then I think, again, in terms of the metrics that we have to judge the success of companies, they potentially aren't also geared towards women at different ages and stages. For example, there's a prevailing thought system that you need a co-founder and that companies with co-founders do better. But this is predominantly based on the Silicon Valley new male graduate model, where actually co-founders do work. And there's a question: do people need co-founders? Do founders need co-founders? Do companies need co-founders, or do men need co-founders? I know a lot of very successful solo female founder companies, but that's actually one of the things that if you apply for an accelerator or for funding through some of the kind of automated systems online, will filter you out immediately. If you are a solo female founder, you have to have a co-founder based on everything that we understand about tech startups using the Silicon Valley model.
Yeah, well, we've looped back around to systemic issues, haven't we? And that's the theme that's going to kind of punctuate this, I expect. I'm going to just, well, first of all, are there any questions on that sort of set of themes? Yeah, we've got one here. Let me just bring a microphone over to you.
Thank you. So not so much questions. I think I just wanted to contribute to this. My name is Mayoni Gunaratne. I'm a female founder of Human Health. So my background is medicine. I'm a doctor. I'm a former surgeon in the NHS, so very much male-dominated specialty. And I created Human Health to really help women with their health and to help them understand their current health situation and set goals and move towards that. So a couple of things. I'm a female founder. I was pitching yesterday and there was a lot of kind of glazed expressions from the male investors who were listening to this. And I had a couple of comments of, so is this about the menopause? You know, and it's kind of no, it's this whole spectrum. Women are dominated by their hormones all of our life. And we don't understand enough about it. And when we do, we're resorting to looking at things on Google or bloggers or influencers, which is totally inappropriate. And I think to Hannah's point, I'm so excited by the work that you're doing. And I talk to patients regularly about their vaginal microbiome, and it's part of our testing. But the point is, my second point is, I don't think there's enough information out there for the general public to even ask for these things. So when I'm talking to them about their vaginal microbiome and how their hormonal status, their perimenopause is affecting that, there's a real eureka moment, and then a real kind of sensation of, right, okay, so there's some proper information out there and we're not accessing it. How do I get this information? So part of the work I'm doing is also to try and create an online education platform, which is actually doctor-led, to disseminate that information. So really it wasn't a question, it was just to kind of say thank you, and it's great that this is even happening today. It's the first of its kind that I've ever been to, so thanks.
Thank you so much. Great feedback, and I think that's a really good sort of feedback, I suppose, from the from what's going on out there beyond this panel. Fantastic. So I'm gonna jump over to the sort of technology bit, right? So we've really got two sort of themes here. There's the founding bit, as Hannah mentioned it a moment ago. There's the founding bit, and then there's the female technology bit. And I'm going to ask Annika if you could kind of maybe talk a little bit about your experience in that space. I know when we were working on the ZSEN stuff, we kind of brought you in because we suddenly realized that when going out to visit ZSEN, you know, sitting in a room full of guys talking about female technology was not the right direction. So luckily we spotted that quite early and got you in. Do you want to tell us a bit about that, and maybe other examples, if you have them, of areas where you've added that sort of value from an advocate point of view and from a creative point of view?
Yeah. So I'm a strong advocate of the end user always. So depending on what end user it is, I think it's very important that they are being heard. So as a designer, I'm trying to make a connection between what end users' needs are and what the technology should be. And well, usually it's the other way around. A lot of technical guys or men, they are developing great stuff on a technical level. But once you are trying to match it with a human, especially with women or niche target groups, the match just doesn't exist. So for ZSEN, what we did is we interviewed 5 women, I guess, about their experience with breast self-examination. It was actually quite interesting. I interviewed both women from the Netherlands, but also from the UK. And already between those different nationalities, there is quite a bit of difference in to what level they are educated by the NHS or by their mothers or sisters about how to approach such a topic. And actually what was quite funny is that women there, well, some women they are interested in how effective this device was in the early what's it called? Early knowing that there might be something going on inside their breast tissue. But actually for them, it was just more important that they could do it easily, quickly, without much stress. Because if you figure, like imagine you're doing self-examination in a bathroom, Saturday morning, you figure out, whoa, okay, this device is beeping orange or red. There might be something wrong. Well, the first time I can contact the GP is Monday morning. You have the whole weekend of stress ahead of you. So that's something we have to navigate as well as product designers. And I think what was quite funny actually that came came about is that women actually found one of the most important criteria, that it would just fit their bathroom cabinet, rather than the stuff male technologists would expect, like, it should be this and this effective, and we want this and this of results from the device.
Thanks, Annika. I've got a question for you, Anna, in relation to this sort of man-woman tech binary. Tell me about how it works for Sensate and your take on it.
Yeah, sure. So we have actually very deliberately chosen to not use gender at all. This is a product that helps mental well-being, where actually it's more stigma for men than for women, and a lot of men sort of are not allowed to cry or talk about issues, etc., culturally. So going back to the unconscious bias. And so I think what's happening right now when we're using data for sales is that we just keep optimizing and actually segregating and discriminating more than ever, because we're sort of just blaming it on our machine learning algorithms, whereas we've really been very deliberate. And I think, you know, there's a choice to be made as well. What values do you have? Who do you want to be? It's not just what you do, but how you do it. So for us with this product, we've made a very deliberate choice that we want this product to be available. And then you have to think about not alienating also segments that maybe have quite strong gender roles and don't associate with you know, certain words or designs, etc. So we're really trying to make it very gender neutral, and it doesn't mean that we can't have a different conversation within gender, but that's, you know, that's also a decision. Yeah, I think that's all I need to say about that.
Fantastic. Hannah or Sophie, do you have any experiences or thoughts around the sort of product side of things, and either how you're taking products to market or challenges that you've seen with the design of products in relation to gender and sex?
In terms of design of the product, for us at Juno, community became really, really important. And I think when you're designing a product for women or people with vaginas in particular, or around, you know, areas that have been taboo for a long time, that sense of you're not alone and community becomes really important, and is something that we had to focus on at Juno really on and integrate into this product, which, you know, essentially it's a test, right? But it had to be more than a test, it had to be a community, because that's what was needed. So in terms of designing the product, I think that was the biggest takeaway or learning that we had. And then in terms of getting the product in front of the people that need it, we've had a billion challenges in terms of like the kind of marketing channels that we use. And it became really obvious from day one that your standard performance channels weren't necessarily the best routes for us, because we use the word vagina very, very freely at Juno, because we are a vaginal microbiome company. But when we first put up our ads, etc., they'd be blocked by Facebook and Twitter for having that word, which is ridiculous, but it's the state that we, and the situation that we have to navigate.
So we're back to systemic issues, right?
I believe that's what makes them systemic, Jacob. On the product side, I think one of the interesting things we had is, again, we really wanted to look at the way that healthcare works and try to deconstruct it a little bit. And then, because obviously we're focused on women, building it back up in a way that was more women-friendly, which means patient centricity, which means making things a little bit more decentralized, acknowledging again that in our part of the world, primary caregivers in the first instance are majority women. So having care that comes to women as opposed to sending them and all of their dependents out to the care is really quite critical. One of the things that we found with the model that we conceptualized, and it's been picked up by the head of innovation at INSEAD, who has a couple of case studies coming out on it. We have a book contracted with Springer that is coming out early next year. It building on it, kind of integrate this integrated care model, and again, like just changing it. People didn't like the fact that we were doing this exclusively for women's health. So when we explained how our hybrid healthcare model worked, they would say, but why is it only for women? And we'd say, well, you know, that's where we see the big gap. There's a huge opportunity in emerging markets. You know, if the women's health technology market is estimated to be worth $1.186 trillion by 2027, and fewer than 1% of those target chronic diseases, fewer than 1% of those target emerging markets, and the next billion people are coming out of Africa. It's a very, very youthful, very dynamic, very innovative, very technologically savvy group that are going places quickly and leapfrogging generations of infrastructure and discovery. So you know, we see this big opportunity, and why would we look anywhere else? But they really didn't like the fact that we had said we're focusing on women's health, and then we're doing something completely new in that context that was applicable to other areas of healthcare. We got a lot of pushback on that, and I think a lot of people actually responded in quite a defensive way to it. You know, it almost worked against us that we had this new model that we were using that wasn't applicable to everybody, or that we weren't focusing on everyone at the same time.
Yeah, so I'd love to drop this like reflective notes. So I have worked before CEO as also CPO and worked with product. And one really fundamental part, or one very frequently used part of product development, is personas. And when you develop personas, you know, it's just a description. You might have a few of your typical users. And so I sort of noticed that sometimes in the personas, the female personas, would be quite sort of stereotypical and quite narrow. And I was thinking about that, and we have to ask ourselves, because we are back now to the unconscious bias. Where does that come from? And it really is storytelling. And so as a woman growing up, I was born in the 70s, you know, we watched a lot of films and content where all the main roles are male, and really profound and interesting, and you get a full complexity of the man's reality. And there's something called the Bechdel-Wallace test, which is if a film has two female roles that speak with each other about something except a man in the film, it qualifies, and only about 50% qualify. So you understand what we've grown up with. And so this has to change, right? And it's also very much because, you know, Hollywood has been very male dominated. And so we have to think about already what stories are we feeding our boys and girls, because it's not helpful for a man not to really understand women's reality. It's not helping anyone. So stereotyping and segregating doesn't serve anyone at all. And I think it's just important to really reflect now that we are in the weeds of the unconscious bias, which is extremely powerful, that we understand where that comes from.
Yeah, it's really interesting.
Yeah, and I think
Go, Sophie. Yeah.
Appreciating that things work in two directions as well. So, for example, people talk a lot now in the UAE about diversity, equity, inclusion initiatives, about making things more accessible for women, but they tend to discount the male portion of the picture. So, for example, the standard maternity leave here is 6 weeks, but the standard paternity leave first was nothing until a couple of years ago. Then it was 1 day, and I think now it's 5. But how are you going to rebalance caregiving unless you have equal parental leave, which is something that we've had in NAVTA since we were founded, but we are really in a teeny tiny minority here in the UAE. You know, if you want to change perceptions, you have to make it as easy and as comfortable for men to do all of the things that you would like women to be doing. And that includes spending time with their newborn babies, for example.
Thanks, Sophie. There's a theme around the geography as well that we touched on when we spoke recently. Have you got any other sort of insights in terms of how that looks? Because it sounds like you know quite a bit about that sort of area.
So I think if we're looking at femtech in general, again, obviously I'm a little bit biased because I'm sat out here, but I do think if we're seeing a lot of movement now in the US and Europe in terms of femtech companies that are targeting all areas of women's health. Again, if you look at, you know, big kind of problem areas that were highlighted a few years ago, everyone was talking about menopause, but there have been dozens of companies now that are springing up that are talking about menopause, and there are some really great, very public influencers. Liz Earle, who I know uses Sensate and did a post on it recently, being an example of one such influencer. But I think there's now a healthy amount of discussion going on this area as a kind of, I guess, a particular taboo or something not spoken about enough until recently. I would say that with everything where we are a little bit behind. We also have a slightly bizarre tech ecosystem, and please just interrupt me if you don't think that this is interesting or relevant. We're very much a product of a company called Rocket Internet. And when I say we, I mean the Middle East, Africa, South Asia, that was founded by 3 German brothers who built a company and sold it in 100 days. And it was a copycat of something that had been done in the US already. And they took this model and they went, okay, we're going to go to all of the countries in emerging markets where like top sort of tech solutions in the US don't exist, and we're going to roll them out at speed. And we're either going to become the market leader or we're going to be swallowed up or we're going to disappear. And so everything, I mean, people refer still to the Middle East as a bit of an ecosystem. A lot of the technology companies you see in health tech, and there are very few in femtech, but also in femtech, are copycats of things that have been done already. And yet you have an investment ecosystem that is looking for unicorns and is looking for 10x returns. And they don't understand that the reason things become unicorns is because they're doing something that has never been done before, not because they're doing something that has already been done very successfully in another part of the world. So we have a bit of an interesting ecosystem. We have one that is maybe 3 or 4 years behind Silicon Valley, that still predominantly invests into e-commerce, marketplaces, logistics, and fintech, and wants to invest in things that it's comfortable with, i.e. things that succeed in other parts of the world.
Thanks, Sophie. Are there any questions at this point from the audience on some of those themes? We started in one place and we got to another, but we covered quite a few things there, from investment through to sort of physical products and the development of those things. Are there any people who've got any experiences either working with female-based products in the market, or interacting with them, buying them, using them, or going for investment on the other theme? No. Okay. And do we have any questions from out there in the ether, or is that not a channel? No, not at the moment. If you're out there in the ether watching this live stream, please do think about participating. We're here to listen. We've got another probably another 10 minutes or so. We'll drift over a little bit if necessary, because I want to turn our attention to teams and people, and I think this kind of brings back together both the product side of things and the entrepreneurial side of things, hopefully. So I mean, at Thrive we took a conscious decision quite a long time ago to be really careful with recruitment and to make sure that we built that in. As a tech company, it's very easy to not end up with a good mix of people, and so we've really put quite a bit of effort into that. I'd love to hear your stories about how you've approached that, and I guess, Hannah, in your case, you've got a very female biased team, so you kind of flipped the thing around. Let's start with you, if you don't mind.
With me, yeah, I'm surprised that you know that, but it's true. I think that the type of people that are attracted to our mission oftentimes rather are women, are people with vaginas. And so weirdly, I guess, when we get applications, we don't see the same sort of inequality in applicants or the candidates that get through the different gates during the hiring process. But what I would like to point out, though, is that even if you're running, a female-founded company and your product is for women, it is still obviously very important to have a mix within your team of men and women, because the problems of women's health or the systemic biases that we are challenging here and trying to get rid of, that burden doesn't just and shouldn't just fall on women. It's for women and men to solve. And so, yeah, we are a predominantly female team, and it's great. There is a really a sort of culture in which people just love to come to work and want to stay and grow. But equally, we're very conscious that the burden of solving these problems shouldn't just lie on women.
Absolutely, couldn't agree more. Anna, would you like to jump in with just tell us about your team?
Yeah, sure. We have a reasonably balanced team, and I've run teams in large organizations and smaller organizations as only ever in technology fields. And I think just a very short anecdote. My studies were all mathematics, physics, electronics, and computing. And there was a point when I was, 21 or something, where I really felt like quitting. And I did just, at that time, it's not like, it's the paradigm and the patriarchal structures, you just don't feel like you fit in. And I went to a conference which is called Computer Girl. And for the first time in my career, I saw women in the industry who I could relate to, and I chose to stay. And that's why I graduated and had a whole career in technology, which I love. So the importance of role models and things like that are really important. And I've seen that. I left a larger company where I had a senior role, and the day I left, there were women that I've never spoken with. They said, "Oh, it's so sorry you're going. We were really happy that you were in the leadership team." And so those things really matter. So I think just by gender, I tend to have more balanced teams, and also very conscious about other hires, because it's obviously age, background, ethnicity, everything, right? It's really important. I am going to admit that when you are a startup, and with a limited resource, much easier when you have a recruiting budget, because you can go to your recruiters and say, "What is this very monoform list? Go away and bring me something better," which I've always done. Whereas very often as a startup, you recruit, you post on your LinkedIn, which is going to reflect your circles. And I have actually raised the point that this is also a real problem in the Bay Area, where the very first founders are the ones that walk away with the millions and billions. And if you just recruit the mates you went to Harvard with, then we are accumulating money very rapidly into fewer and fewer hands. So I'm very much for positive bias, because there is a huge unconscious bias going one way. If there is no counterforce, then it's not going to change. If you're doing nothing, you are just perpetuating the problem. So I'm very much for sort of biasing positively, as in two equal candidates, you choose some minority group, I guess.
Yeah, I think I agree. It's important to kind of just really hit the problem head on, and if it involves doing that, then so be it. Annika, you work with a range of different teams. You work in lots of different companies, going in and doing certain bits of work. I can sort of speak from my experience as an engineer in electronics and that kind of industry, or that kind of world. As an education, I found virtually no women in my classes when I was doing my studies, and then teaching afterwards the same. So that was 10 or 15 years ago, and it was really terrible. How has that played out, I suppose, in terms of technology development on the front line, as it were, when you're working with teams?
Yeah. So I studied in Delft, TU Delft, industrial design engineering. So in fact, I'm an engineer as well. And when I studied, I think I graduated now for 10 years ago. So also 10 years ago, it was already 50% male and female within our studies. But we were an exception within Delft University. But luckily, it also caused that most of my clients have a very diverse team, at least the ones who have people from industrial design here in the Netherlands, which I think is really nice. So on one hand, I want to go back to what Anna just said. Like, if you put out a vacancy, you will probably attract people within your network, and maybe also more male-dominant people, because they are just the ones that bring in the money. On the other hand, I'm self-employed, so I work a lot with extended teams, so the teams of my clients or experts that I need for my work. And I think if you're very conscious about what kind of experience you want to bring on board, you can find the right people. So currently, I also have someone on my team who has actually a severe chronic disease, Duchenne muscular dystrophy, and I'm really glad he joined our team. He can only move his thumb for a little bit, so someone really needs to help him, assist him to sit in front of his laptop, start up the video call. But he's very bright, so in our conversation, I think just to have a conversation of 1 hour per week with him just adds so much more value than to have someone else with no experience with this disease not in your team. So I think diversity is not only bringing on board women or people with a different cultural background, but also bringing on board people with certain diseases or with a distance to the I'm not sure what the proper English word is. So I think that's something that you need to be cautious about or conscious about.
Thank you, Annika. Fantastic. Sophie, could I ask you to sort of maybe talk a little bit about your team, but also about the teams you work with in the UAE and how that sort of plays out as well? Because as you mentioned, there's quite a lot of difference from Europe and where you are.
Yeah, I think that, so the UAE is a very diverse place, over 200 nationalities, and unlike a lot of countries in Europe, you don't really have minority populations. You have quite an even representation from many different countries around the world. It doesn't mean that people hire very diverse teams. A lot of the teams are quite homogenous. And again, I think that's due to the same kind of network effect. Actually, our team is, I think, still my proudest accomplishment. We have 57% women, 43% men. We work in 11 different countries. We have people who are still studying at university, and we have people in their 50s. Our C-suite, all of the women in our C-suite are mothers of varying ages. We all, funnily enough, have children under 5. We have, in the last 12 months, actually had our CTO and technical project manager go off. Raza is a guy, so he went on shared parental leave, and our technical project manager also went on shared parental leave. We've had 1 ectopic pregnancy. We've had 2 people trying and struggling to fall pregnant. We've had 2 women hitting perimenopause and battling, firstly not realizing it for a while, and then dealing with the challenges associated with it. We have a really beautifully diverse team. And whenever I look at our team, I think the argument again for diversity is made because everyone has a very strong opinion. Often the opinions are very different, and the way of expressing these opinions is very different. And so sometimes when people join the team for the first time, they're a little taken aback because most of our team embody Jeff Bezos's thesis about holding strong opinions weekly. They're very passionate about women's health. They're very passionate about their own experiences. And until you convince them otherwise, they will insist that this is the way things should be done. But they are also willing to communicate and collaborate, and it creates the atmosphere is a very dynamic and very open one. And yeah, I mean, they are without a doubt my proudest accomplishment. I think one of the reasons for that is because of where we are, because it attracts such a diverse group of people, but also probably because of the way that we've gone about finding people. We've never really, I don't think we've paid more than about $5 per person to recruit anybody. It's always been a LinkedIn ad for a 24-hour period. We've been quite open-ended with requirements. One of the things that we found when you're trying to hire women, and again, there's been a lot of research done on the hiring process, and is there any unconscious bias again within it? One of the things that we found is that if you make the requirements very narrow, you tend to have fewer women applying because they'll look at all of the narrow requirements and go, I don't meet every one of those, so I'm not going to apply because I won't get the job. Whereas if you keep the requirements broader, you'll get a lot of women who can then tell you very specifically what they've done against those, but they apply where ordinarily they wouldn't. So yeah, I mean, again, there's a lot of effort now. It was just announced in the UAE that it's going to be mandatory from 2022 to have at least 1 woman on every board. It would be nice if it was 50%, but the boards are so heavily male dominated here. Even to have 1 kind of mandated woman on every board will make a difference. The UAE in general has really good statistics in terms of female representation at every level of business, including in the sort of decision-making echelons. And I think they have more female ministers than just about any other country, and have a pretty even split. I always say, the Middle East, people who haven't been here can sometimes get a bit of a bad rep, but actually you'd struggle to find places that are more tolerant and open than the UAE and other countries in the GCC.
That's fascinating stuff, Sophie. Really amazing story to hear. And I was surprised at your comment, to be honest. I thought it might be less diverse than you describe it. That's fantastic. From the floor or from the internet, are there any questions around building teams, making diversity a big issue and making it happen and sort of blazing a trail? Because clearly our panel have got lots of experience in doing that. We've got one question here.
Yeah, so I have a question to Anna and somebody else as well. So it's about investment. So question is, you guys mentioned that as a female entrepreneur, it gets difficult to find investment. But there is also a completely other story as well, where if you have a female founder, then it gets easier to get an investment. Is that true? And how are your experiences on both? Because I can talk about myself. Like, I have been investing in fertility space, and I was asked by one of the founders here in Giant, do I have a female founder? If yes, then they would consider the investment. So there is a other part as well, I suppose.
Yeah, thank you. So it's surprising that it's not showing in the numbers. It's actually less money this year that went into female-founded companies than in 2018. So it's not even going in the right direction. And so there's a lot of talk about it, and you hear this, well, you know, it's just like, oh, well, it must be really easy. It's not showing in the numbers. I think that, you know, what probably works is to have a token woman on board. So you got 3 guys and then, yeah, just bring in my sister. And yeah, we've got female founder type of thing. Whereas, as I mentioned, only 2% go into only female only founder, whereas 82 go into male only founder companies. So we're not really seeing that shift, unfortunately. But you know, at least there's a conversation there.
Yeah,
Hannah,
I would suggest that.
Sorry, Sophie. Yeah. Hannah, no, you go.
All sorts of excuses about. Sorry, I think there's a lag. Investors will give you all sorts of excuses if they don't want to invest in you. It's one of the lessons that you learn, especially if you pitch from a deck, which increasingly we don't. We'll share our deck and then we have a conversation. And it's very much trying to establish whether the investor is right for us as much as we being sort of appealing to them. But if an investor doesn't want to invest in you, they will give all sorts of reasons without saying upfront, I'm not interested in investing. And my gut instinct would be, given the fact that the sort of push to have co-founder teams isn't necessarily resulting in a greater proportion of the funding going to them, is that is being said by investors. It's probably the sign that an investor is not interested in investing in you and they're just finding an excuse. It doesn't mean that you don't have an investable proposition. It just means that they're not the right investor.
I was just going to make another little comment here, which I would normally say, but I did recently, because I thought it should be easier to raise this round. I looked at a lot of early stage deals. Actually, I've also been consulting in venture-backed companies, and I really thought myself it's super easy to raise money given our traction and usage numbers and so on. So I spoke with a couple of more senior women, and they would never say this out loud, but they did actually say, well, Anna, why don't you pitch with your white middle-aged male CFO? Because that's what I did. Put him in front. It will be easier. So that is actually advice that behind, you know, in one-on-one conversations. Just recently, I've got from women that are further ahead on their career. So, you know, to your point, it's unfortunately not really where we're at. And obviously there's loads of other bias as well in terms of where the money's going. Back to my point, it's no longer the explicit excuses. No one's going to say, I don't, people generally say, I want to invest in more diverse, I just can't find them. And then they don't go into what is my unconscious bias or what are my processes? Why am I failing myself at achieving this that I'm trying to achieve?
Yeah, great point, Hannah.
Yeah, sorry, can everyone hear me?
No.
Yeah, perfect. I was saying that I think I perhaps understood the question a little bit differently. So I understood it as, if as an entrepreneur going to a VC, if you have a female investor in that VC or a female LP, do you get better deal flow? Am I more likely to, want to pitch my company to you? And the short answer is yes. And I wonder if that was an aspect of the company and if the rest of the panel also has a view on that.
Yeah, sure. I absolutely agree. Like, it's definitely a big issue. And just dropping some more numbers, I think it's only about 13 to 15% women partners in the US. So it's obviously highly underrepresented as well.
I think
there was a really interesting statistic that came out. I think it was even today, about the investments of founders who've achieved unicorn stages, who've become billionaires in the US. Now, there was obviously a significant disparity between male and female. I think 724 investments had been made by male investors, and there was a smaller pool from women. But of those, statistically, from the male pool of billionaire founders, 6% went to female-founded companies, and I think about 12 to 14% went to co-founded companies. And then from the female pool, 22% went to female-founded companies, and 24% went to co-founded. So immediately, the number of women represented in the founder pool more than doubled. Which is indicative of the fact that if you have women who are getting to a point where they can invest, they will invest in a more even way. In fact, in an almost 50-50 way. So it's not that women are exclusively investing in women; they are investing in a much more balanced way. I think there are so many different problems in terms of unconscious bias, or pools of unconscious bias within the investment ecosystem. There's the general partners who are going out and speaking to limited partners. There's the limited partners, very few of whom are women. There's the wealth and investment advisory groups that are advising these limited partners, a lot of times institutions, family offices, high net worth individuals, on investing in funds who are almost exclusively white males. And so you've got different pools. There's also a significant lack of female angel investors in the ecosystem who are investing at women at pre-seed and seed stages. Interestingly, so we just launched a movement called 2022 Female Angels to identify and publicly list 2022 female angel investors for the Middle East and North Africa by the end of 2022. We've appointed a 30-person steerco that is 15 men and 15 women. And we are now, from the start of next year, going to be working collectively to increase substantially, and it would be a 20x increase at least, the number of female angel investors who are known to be investing in MENA, on the basis that there are many areas of the investment ecosystem that need to be addressed. This is one that we, as a group of entrepreneurs and people working in the system, can target, and so that's what we're going to do. Because again, I think, referring to a point made earlier, there seems to have been a bit of a shift in terms of the willingness to consider, to continue accepting this as the status quo. If we go backward next year, there will be uproar. There will be revolts in the streets. I think people want now to see a significant shift in favor of a more equitable system.
Completely agree, Sophie. We have to see that positive change next year. So I'm gonna wrap things up, I think, by just dotting around the panel and just getting your conclusion, just jumping back to our kind of starting point, which was around blockers and opportunities in the space. Do you have a final thought, maybe just a quick 30 seconds on, a bit of a positive take on things and where you see the challenges still lying in terms of either what you're doing or more generally, if that's more appropriate? Let's start with Hannah.
Okay. Yeah, so I mean, I love that this panel is even taking place, and it's meaningful for me because I went to Giant a couple of years ago, and I didn't see a focus on the sort of problems that I wanted to see. And so I love that the discussions are happening in the UK and the US. So Juno Bio is based between London and San Francisco. We're seeing a real shift in our community of femtech founders and also in policy in terms of focusing on women and women's health. And although there is, a lot of work to be done, especially when it comes to funding, I feel like we're moving in the right direction where we are at the very least.
Fantastic. Annika?
Yeah, so personally, before this panel, it's not on my daily top of mind that I'm a female founder and that I have certain limits that I need to overcome or boundaries. So it's really good that these kind of panels are there, or these kind of discussions, that at least that in certain countries or certain landscapes it's a bit better than in others. That said, I think the end user of your product is always the most important one. So we should also approach these women or the users as experts, because they really are. Especially what Sophie also pointed out in being a primary caregiver, having to manage things both at work and at home. And I think those kind of insights are very, very valuable for product development. And maybe lastly, and that's maybe from a design perspective, is that women's products shouldn't all be pink. I think we should, we're beyond that phase of just adding a pink sauce on top of women's products. And we should really deeply understand what their needs are and emotions and how we should address those. And probably they are better off with something that isn't pink, but that just can fit into their bathroom cabinet really nicely.
Fantastic. Thank you, Annika. Anna?
So I guess one sort of concluding pledge is, and it's also to the point of Annika not being pink, is that seeing everyone as individuals, and that goes for men and women. So very often it's women want this, or women drive like this, or women bosses are like this. We are not one category. We're completely different. And especially in a professional environment, there's more commonality than difference. So I think we need to just really understand that it's not one big group, that we all want the same. And then I want to just give some gratitude both to the men in the audience and to Jacob, because that engagement really matters and it's really appreciated. So just, it is actually sort of reasonably diverse room, and that also goes back to the point that it isn't just it's a topic for women. I do have a lot of hope in the younger generation. I see the gender roles not being so extremely strong, and it's damaging for everyone. I mean, we work with mental well-being, and the fact that men should be so tough and never fall apart and always be strong is also extremely damaging, and not developing emotional intelligence as a little boy because you're supposed to just bottle up. It actually ruins your nervous system. So we should just, look at ourselves as these diverse, beautiful beings that we are on an individual level.
Well, that was a nice place to finish, but Sophie's going to get the last word.
I was just going to say, on bottling up emotion, you reminded me of a scene that plays out in our house very often between my 4.5-year-old son and my 2.5-year-old daughter. And the 2.5-year-old is a complete lunatic and winds him up no end. And she'll have done something mean, like knocked over all his leg or pulled his hair, and he'll start crying, and she'll go, "Stop crying, Oliver!" And Oliver will go, "It's okay to cry." and then we go, "Yes, Oliver, it is okay to cry." Eleanor, stop being nasty to Oliver. But I think, raising children with an open mind and encouraging their curiosity and encouraging them to be who they want to be is very important. My end point actually is that if there's one takeaway from this, please understand that women's health technologies are a massive opportunity. They're a huge opportunity globally. They're possibly even from a proportionate sense of the word, even an even bigger opportunity in emerging markets. My favorite quote is from Victor Hugo, which says, "No army in the world can withstand the strength of an idea whose time has come." And I think it is femtech's time.
Well, let's leave it at that. Fantastic. Thanks everyone for coming. And we are a little late finishing as we predicted. We'll be back here at 11:30 and it will be the AHSN and how can we support innovators in demonstrating impact in the real world. So if you fancy getting involved in that, all the speakers are very eminently connectable online. So do reach out and have a chat to them if you want to offline. I'm sure they'll be receptive. Thank you again to everyone for joining the panel today. Really great to have you.